I'm Daniel Farthing, I'm the head teacher at Bulwell St Mary's Primary School.
I'm Emma Hampton, I'm the SENCo at Bulwell St Mary's Primary School, and I'm the SEND Associate at the Transform Trust.
The focus on inclusion has grown over the years, and we knew that there was a need to adapt the provision that we have to the needs of the children coming through. We tried various things that some worked, some didn't work, but then when Emma took over as SENCo, she was able to identify the needs, special educational needs of the children coming through the school.
Yeah, so I looked at the SEND register as a whole and unpicked what was our most prevalent area of need, and it came out as social, emotional, mental health, followed by communication and interaction. So at that current time, we had a behaviour mentor in school, which didn't really fit the needs of our children.
Because we were tackling the behaviour as it happened, rather than going back to what the behaviour was trying to tell us and what the roots of that behaviour were.
So we embarked on getting one of our members of staff trained up as a learning mentor, and she was then able to do more strategic provision and intervention to support those children. We then moved on to communication and interaction children, and we sought advice around speech and language, and we then went and employed a speech and language therapist for a day a week to build capacity in school, and she's currently training up one of our teaching assistants to carry out evidence-based intervention to support those children as well.
And it's evolving picture as we develop with CPD for the learning mentor. The range of provision and the range of interventions that we're able to provide for our children has increased over time.
And we've been able to identify CPD at various levels. So we've had a range of interventions being taught, and we've also had a range of CPD for class teachers so that their understanding of our children and their context can be also supported within the classroom.
So born out of what we trialled before, we decided that the learning mentor was the way forward. So we began trialling the learning mentor role on a part-time basis, which began at 3 afternoons a week. This then developed into something more as we saw the need for this.
So once we trialled the 3 afternoons a week, we moved it to full-time when we could see the impact that she was having on the ability of the children to be in the class accessing their learning. She started off with quite a small range of interventions. One of the key things was she went out to various schools, and from this she picked up about drawing and talking. So one of her biggest CPD opportunities was to learn how to become a drawing and talking therapist. This has had a massive impact on some of our children, because although their needs aren't ready for full-on counselling, she's been able to use it as an early intervention to any worries or concerns that children have in school. From here we were able to involve the behaviour support team, the local authority, who knows the school really well and knows some of our children, and they were able to signpost her to some other interventions such as proprioception, key attachment person, and then that grew from there. And from there now she's become an ELSA, which is an emotional literacy support assistant from the education psychologist. So she's got a raft of interventions now, all of which are evidence-based, all of which have entry and exit data, so we're able to show what the impact that they're having on the children. We're also able to start with an intervention and perhaps change the intervention if it's not the right intervention for the child. And she's able to consider all of the interventions she's got and which would suit those children best.
Right. And with such a complex range of needs in school and such a vast array of interventions now at our disposal, we needed a safe, nurturing space for our learning mentor to work in. And this is developed now. It's called the Jigsaw Room. It's called that because this is where you go to put your pieces back together. The messages and the environment in this space is where children go and they feel safe and can access the interventions with the learning mentor.
A lovely part of the Jigsaw Room is the fact that some of the vocabulary that's up on the walls, some of the posters that are up on the walls are also in the classrooms. So even when they're back in the classroom, there's a little piece of the Jigsaw Room that is in there that they can look at or feel safe with.
So it doesn't happen in isolation, it transitions across from the learning mentor room, from the jigsaw room into the classrooms, and then permeates throughout the whole school.
The key outcomes for our children on the SEND register is that currently we have a 3-year upward trend by the end of our Key Stage 2 results, with our SEND children achieving in line with other children within the school, and in some places even doing better than them.
It also develops and strengthens the relationships with the external agencies that we work with. We're able to sit in meetings and talk to other professionals about the provision we can offer for our children that perhaps they wouldn't be able to access otherwise.
One of the other key outcomes for our children is the fact that there are more children within class accessing their learning. Teachers are more aware of their needs, so they are doing things within the classroom as part of quality first teaching in order for them to be able to succeed. So it's not just the provision that's enabling them to have outcomes, but it's had an effect on the quality first teaching that those teachers are providing. And also our behaviour data. So although we still have children who are challenging, we're seeing a reduction in those behaviours. We're seeing behaviours perhaps not being quite so hard behaviours, challenging behaviours, and we're able to predict and prevent more easily for these behaviours.
So, and from this base of inclusion, other things are born out of this now. So, for example, our children designed a playground under the remit of promoting physical and mental health outside of school. And with our 6 core values in school, they were able to plan and design a really huge project over the course of the year. So where the children can now access everything that they're doing inside of the school, outside of the school as well. And that just strengthens the universal provision that we have for these children, for our children.